Hello everyone, welcome to another video. My name is Dr. Surakshith Battina. I'm an endoscopic surgeon and a fertility specialist working at Indigo Women's Center in Chennai. And today we're going to talk about fertility preservation for trans and non-binary folk in our society. Starting hormone therapy or undergoing gender affirmation surgeries are one of the crucial factors for trans and non-binary folk, especially on their journey of self-understanding. However, these steps come with the risk of impacting their future parenthood. Fertility preservation is a process of saving either the eggs, the sperm, or the reproductive tissue so you can have your own biological children in the future. There are different types of fertility preservations that are available for trans people, and it all depends on the age, the stage at which they are at in transitioning. It also depends on their pubertal status and also their gender identity. But before we get into all of these options, let's go ahead and press the subscribe button and go ahead and press the bell icon as well so that you don't miss any of my future updates. Estrogen can reduce on the sperm count and the sperm quality in trans women, and also individuals who are undergoing an orchidectomy, there will be absolutely no sperms anymore. For these individuals, sperm banking is a viable option where they can go ahead and ejaculate a sample, and this sample will be frozen for later use. If the individual has multiple samples stored, they can use the sperm later for a process called as an IUI, also known as an intrauterine insemination, where they would go ahead and inject the sperm into a gestational carrier. But if there is only one or two samples left, they can use this sample for a process called as an IVF, which is also known as in vitro fertilization, or an ICSI, also known as intracytoplasmic sperm injection. Injecting testosterone into trans men can stop ovulation and menstruation altogether. Egg freezing or oocyte cryopreservation is a viable option for these individuals, where they would go ahead and inject hormones so that we can retrieve more number of eggs from this individual, and once we do that, we can go ahead and cryopreserve them, which can be used later with an IVF or an ICSI procedure. Embryo freezing is another viable option for trans men and trans women, where they'd go ahead and inject the gametes either with a donor sperm or an egg, or they would use a partner sperm or egg and make an embryo. And this embryo can be preserved for however long they want, and after which they would go ahead and inject this embryo into a gestational carrier as and when they want to become parent. Ovarian cryopreservation is a fairly new procedure where a part of the ovary is removed and then it is later put back or transplanted into the patient, at which point they can either conceive naturally or through the process of IVF. It's a similar process for trans women as well. A part of the testis or the complete testis can be removed and cryopreserved, which can be later transplanted into the body, and the patient can try to either conceive naturally or through a process of IVF. If you want to know more information about fertility preservation, I would urge you to talk to your fertility specialist who has some training and who has some experience in dealing with trans individuals. Fertility preservation is a very complex and an emotional journey for trans individuals, so I would suggest you to talk to your partner and to your fertility specialist to understand which option will work best for you, and also weigh in the pros and benefits of each. There is absolutely no guarantee if any of these procedures will work for you, so make sure you explore all your options and also have very realistic expectations. I hope you found this video useful, and if you have any more queries about fertility preservation, go ahead and leave them in the comments down below. And if you like this video, go ahead, give us a like, share this with your friends and colleagues, and do subscribe for more such information.